2. All right, you guys. All right, guys. Again, thank you guys so much for joining me. My name is Abel from Revamp Fit, and I hope you enjoy the rest of the town hall. Again, I'll see you guys next time and have a great meeting.
That was awesome. Thank you.
No problem. Appreciate you.
I feel like 55 years again.
Yes,
let me turn up the music.
But that was awesome. I'm feeling great. Thank you so much, Abel. Shout out to Revamp Fit. Shout out to Abel for always being here for us to get us rooted in the moment with a little bit of movement. Thank you.
Absolutely.
So before we kick things off for real, I am going to ask everyone to please fill out a quick poll. Jason, if you can launch that for us. This information won't be shared with anyone other than like our internal team. And it's just to make sure that we are really catering to the needs of the community and we sort of get a read on what you guys want to hear and know about. So if you could take a couple minutes to fill that out, and then we will start off our conversation with Dr. Mullen and Dr. Walker. All right, so we'll just take a couple more minutes to wrap up the poll. If you could finish your answers, that would be great. All right, Jason, can you close the poll for us? Awesome. Thank you. All right. So tonight we are very excited to welcome Dr. Jewel Mullen and Dr. Eleanor Walker. Dr. Mullen has an MD, an MPH, and an MPA, so very well decorated, is an Associate Dean for Health Equity at the University of Texas at Austin Dell Medical School, and an Associate Professor in the school's Population Health and Internal Medicine departments. She's Deputy Assistant Secretary for Health in the U.S. Department of Health and Human Services and Commissioner of the Connecticut Department of Public Health. She is recognized nationally and internationally as a leader in building effective community-based chronic disease prevention programs and for her commitment to improving individual and population health by strengthening coordination between community, public health, and healthcare systems. So Dr. Mullen, welcome. We are so excited to have you with us tonight.
I'm excited to be here. Thank you.
Of course. And our other wonderful guest this evening is Dr. Eleanor Walker. She serves as the Director of Breast Services in the Department of Radiation Oncology at the Henry Ford Cancer Institute and is the Medical Director of HFHS Center for Integrative Medicine. She attended Washington University School of Medicine in St. Louis, Missouri, and completed her postgraduate training at Vanderbilt University Hospital in Tennessee and University of Maryland Hospital in Baltimore, Maryland, where she also completed a fellowship in the Department of Radiation and Oncology. Dr. Walker has clinical interests in breast, prostate, radiosurgery, and cancer incidence and treatment in minority populations, as well as special research interests in breast cancer and integrative therapies. So lots of wonderful interests and so very excited to have you with us as well, Dr. Walker. Thank you for being here.
Thank you very much, Carmen. I'm excited to be here and to meet Dr. Mullen.
So I'm very happy to be having a conversation with the community and with both of you this evening. I think the first thing that I would like to ask the both of you would be, what are some COVID-19 updates that you think are important to share with the community, especially in relationship to your own fields? What are things that you've been discussing with other doctors in your workplace?
So I'm really happy to double team this conversation with Dr. Walker, and we'll probably over polite one another for who answers first. I'll start and say, once again, thank you for having us. And I think where I would start is a year into this. As some of you might see that I always have sitting behind me this sign that says "Be Happy." So thank you for the introductory music, because it really is important to me. But I mention that because for all of the dismal things that have happened to so many people and are still happening to so many people over the past year and before the past year, I still feel hopeful. I still feel hopeful. And I have come to a place in the pandemic where I have also wanted to have the African-American and other minoritized communities take our own narrative around what's happening with us and what our future looks like. So that's not a really specific answer, except for it is extremely specific in a way, because a lot of our future physical, emotional, and social well-being is going to depend on what we do individually and as community. And I'm going to stop and toss it to Dr. Walker.
Well, thank you, Dr. Mullins. I want to say, like you, I am hopeful now. I personally have been touched by, not only in my patients, thank God not as many patients, but personally with many losses in the last year. But I'm happy now that we have vaccines and strategies available that are helping us to cope with this. Now, it's still very difficult with cancer patients. They're going through, some of them, a new diagnosis of cancer. Some of them were in the middle of treatment when we started this, and there were adjustments that had to be made, but we never stopped treating, because it's very important. And unfortunately, in minority communities, particularly Black, Hispanic, Native Americans, we have high cancer rates, which is why the encouragement for screening is so high, and we were doing well. But unfortunately, screening went down for a certain amount of time. And now where people are coming in, yes, cancer rates drop, but I think some of them had to do with not being diagnosed. And a lot of our community, we're trying to help each other, trying to bring people in now, especially, and asking the question, should they get the COVID virus? That, I think, is a big thing among cancer patients. And I think it's important that they should, and their caregivers. So I'll bounce back to Carmen.
Wonderful. Thank you so much. I think that both of those responses were very spot on. So as far as I think, Dr. Mullen, you mentioned the importance of supporting one another through COVID-19 and how to support each other as, a community in the midst of a pandemic. I know, Dr. Walker, you touched on that as well in relationship to caring for community members who may be at risk for cancer, et cetera. So could you, Dr. Mullen, explain sort of the idea of public health and community wellness? What is your take on that? And what role can each of us play in that effort?
So if we think about public health as what all of us do together to assure that people can be healthy, there are so many layers of that, starting, as Dr. Walker was alluding to, like the personal level, what we can actually do. And that certainly is a piece of it. But as someone who has worked in government, I know the ability for people to take as good care of themselves as they can and of their families and their communities depends on having healthy environments. It depends on having the policies that support them. It depends on having health insurance. It depends on housing, and feeling that you can get your kids back to school and keep them on a path where they can grow socially and economically and emotionally. So all of that rolls in together. And I'm a doctor and I'm a public health person. And I remind my physician colleagues that we own a piece of that, but that we have to work more effectively with public health systems. The other thing that I want to add at that personal level is I think increasingly people are starting to understand how critically important mental health is within public health, physical health. They're really connected. I used to say you can't take the head and disconnect it from the rest of the body. So right now, I'm also really encouraged when I go into communities where people are just supporting one another and owning as part of their strength, how many things that they're struggling with so they can support one another. Okay, I'll give it back to you, Carmen.
Yeah, thank you. Dr. Walker, is there anything that you would like to add?
I would love to add, I totally agree with Dr. Mullen. And I think what you see in our communities are trying, as she said, for people to interact and talk. And yes, the onus is also upon us as physicians to help patients. One of my interests is integrative medicine. How can I help my patients navigate their cancer treatment in a holistic way? And although we had to discontinue some in-person treatments like acupuncture for a short while, not very long. We stopped our group acupuncture rather than our individual acupuncture, but we taught them acupressure. We also took our yoga online, our exercise classes, our Excite program, which we have for cancer patients in conjunction with our preventive cardiology. We took that online for people to be able to do that. For our communities where they didn't have video, we tried to send them mailings or recommend maybe some TV options that they could look at to help them. And the mental health portion is so important because if you're exercising, hopefully, if you're doing the right exercise, some endorphins are going off to help people as they go through this. You need to try and feel good and have our psychotherapists also calling the patients and talking to them and letting them, because people had those social issues. They lost their job. Am I going to have insurance? How am I going to pay for this treatment, this acupuncture treatment? No, it's for you. It's there. It's included. It's free. So it's letting patients know that we are here for them. We're advocating for them, and the communities are advocating for each other. Churches getting together, people like Abdul coming in and working with our patients virtually or just talking on the phone. So I think it's very important, and keeping women, especially who got taken out of the workplace, to help them help their kids and to keep saying themselves.
So Carmen, I need to add something.
Go right ahead.
And as a public health doctor, I also want to say public health is not politics. Public health is not experimentation. Public health is not Big Brother trying to tell you how you're to live your life. This conversation that we're having is really about public health also still, no matter how many hits a lot of well-intended people took over the past year, trying to give people the information they need so that they can have power over their own well-being. At the same time that we do the work to do things like get vaccines out where people need them.
As someone with a background in public health, all I can say to that is amen, thank you, because I agree with you 100%. So I think along the lines of what we've been talking about a little bit, and I heard Dr. Walker, you bring this up a bit in relationship to treatment for your cancer patients. We've talked a lot in past town halls about how managing chronic illness and other health conditions, especially during COVID, it's really important. Could you elaborate on maybe some strategies to help people stick to a wellness plan? What are some suggestions? I mean, I know you put some out there, what you all are doing, but if either of you have ideas or recommendations, and also just reinforcement on, why is it important to take care of our, chronic conditions or health generally during this time?
Well, I'll say, I think that people have to try and have some trust in their medical systems, and that we are trying to make it as safe as possible for you to come in. Yes, there was a hold for a little while on breast screening, on colorectal screening, on lung cancer screening, GYN, all of those areas that are very common to our community in general. But once we open screening back up, please don't be afraid to come in. We are bending over backwards to make sure that you're well taken care of, that you're safe. Any family member that must accompany you is safe. And because it's important that you get these screenings. The problem that we're going to be seeing is there was a decrease in screenings and diagnosis of cancer in the last 6 months or so. And unfortunately, because people were still afraid when things opened back up, they didn't come in, and there are going to be later diagnosis of cancer, which we will see in the next year or so. We want to get you when cancer is very treatable and early, and you can have excellent outcomes. So it's so important, but you've got to watch your blood pressure, watch what you're eating, exercise. All of this contributes to a healthy whole person.
So 10, 11 months ago, we started hearing a lot of what people felt were the blaming the victim explanations. Why are so many Black and Latinx and Native American people suffering more disease and death and hospitalizations from COVID? And then people would start to say things like, well, I am not my pre-existing conditions. A lot of the ways in which I can be healthy and take care of myself are also tied to the social factors that I live within. That's true. And a lot of times when I give talks and people think, yes, she's on our side, she really understands, then I say something like personal responsibility. And then it's almost as if I flipped on folks, because personal responsibility, isn't that code for something? Well, what it's actually code for is that we always have something in our hands that we can do. And I mean, Carol Moore, I never met you before, but I'm high-fiving you and what you just said about not smoking, which is something that I'm still doing with my sister who stopped smoking. She also did get COVID and she did fine, but I'm lucky that she did. But I had a conversation with some other African-American women physicians last week when we were saying, we don't want to go around and say to people, well, diabetes, obesity, cigarette smoking, heart conditions, and just remind people of what might be wrong with them. But a lot of us sometimes figure out ways to explain away reasons that we could do more for ourselves. Okay, I said explain away, I didn't say denial or deflect. But if we actually want to believe that if we present ourselves, somebody will do something for us, then we can just own, yeah, that sounds like me. That sounds like me. I'm in that category. And I mention that right now because there's been so much talk about when am I going to be eligible for the vaccine? I'm not old enough for that category. But a lot of those medical conditions in many states still qualify people even if they are younger. But if we only focus on age, but we forget that we're diabetic or hypertensive or healthy, thick, overweight, obese, 3X, whatever people think they want to define themselves as, then that can make us step forward and say, I want what I'm eligible for now.
The other thing I would say, I always tell my patients that we will do everything we can to help you have an excellent result from your cancer treatment. But you have your part, as Dr. Mullen says. You have to, it's a shared thing between your provider and you as the patient. So yes, I do have patients who will say some things to explain away certain things, but then I will say, okay, but what do you think about this? And then they're like, you're right. I do have to take some responsibility, as we all do. I'm not innocent of not trying to explain away, oh, I'm tired. I don't think but yeah, I could work out with her online since I can't go to the gym. Oh no, I'm on call tonight. I may have to stay at the hospital, so I'm going to cancel that. You know, we all make certain decisions as to what we want to do about our health. But I think, as all of us have seen, well, most people with this pandemic, there's been a lot of weight gain that has gone on, and not just in patients. So I have made a concerted effort to do better myself. And I have been. It's been slower than some other friends of mine, but we all are supporting each other to do it. And that's all we're saying. We're here as your support to your friends. You have to take part in your own health. We can't do it alone.
I completely agree. And I must say, I am certainly guilty of, in some ways, as well, explaining away, oh, I have to cancel. I can't do that. But you're right. It is important that we support each other as a community as we continue forward. We actually have some great questions in the chat, and I would love to ask both of you. So Carol, we shouted her out for quitting smoking. Yay. We love it. We got another question saying, I am indecisive in taking this vaccine. I made an appointment, but I've never taken a flu shot and I feel I'm not sick. So why take a vaccine? So would both of you be able to speak to that? I think that this is a really important question.
You're on mute.
I'll let you go first because you are public health.
Yes, Dr. Mullen, we'll hand it to you first.
So anyway, it's a fantastic question, and one that, a statement that I hear a lot of people talk about. So there's the public health why, which is all the messaging that we've been hearing about how important it is for people to do whatever it is they can to protect themselves. And that even as the tried and true public health measures, like keeping physically distant, masking or now double masking, hand washing, hygiene, those things are important. We have seen so much that this coronavirus, COVID, isn't like any old other virus. And so what does the vaccine do? The vaccine adds another layer of protection for you and for those around you. And here are some of the things that can benefit you, because we've already heard that a big chunk, whether it's going to be 30% over time or 40 or whatever, of people who have coronavirus don't really have symptoms, so they don't realize the symptoms are coronavirus. Those people can also be spreading it to family members and to others in the workforce, et cetera. So there's the protect oneself and the benefits that those around us also can have. The other thing is that, yep, I don't know, I had the flu once, and after that, I got the flu shot because I never wanted the flu again. And I'm a doctor and I get it every year. But coronavirus has the potential to make people a lot sicker and up their risk of dying even more. And I don't know the age of the person who asked the question, but a lot of those viruses that we get over time, we're still learning that this might not be a one and done, you get over it and you're fine, what the long-term effects of it might be. So, I'm a public health person, so I'm an ounce of prevention, pound of prevention kind of person, but there are benefits for one. And if we think about ourselves as part of a bigger society, we are all suffering from having a country that doesn't have immunity to the coronavirus. We're suffering physically, we're suffering emotionally, we're suffering economically. So I'm not trying to talk you into it. I'm trying to talk to you into having the conversation that keeps you from canceling your appointment and asking every question that keeps you on the fence. Dr. Walker, what would you like to add?
I totally agree with you. I think we've lost a lot this year because we didn't really have a national policy. And something that a friend of mine who was very hesitant, I think she's still on the wall about getting the vaccine, but she noticed, wow, nobody's really had the cold this year. Well, the cold is a coronavirus, but because we've been washing our hands, we've been wearing masks, we've been socially distancing, that virus didn't get past either. So there is some protection. And I always have a village mentality. If I can help somebody else, then, and in helping myself, then I'm going to do it. Now, I can't say that I do a lot of clinical trials, so I like to see a lot of long-term data. That is true. But at the same time, something that can help the country, help all of us do better and not die, I feel is important to do. So I got the vaccine. I didn't get it the first week it was offered to me. I talked to people and then I made a decision. Okay. And it wasn't required, like the flu vaccine is kind of required for us as physicians at my health system to get annually. It wasn't required, but I made a concerted effort. And I think everybody should talk about it and ask their questions. And then you do have to do what's good for you. But remember, and you going through this, and it's been really hard. It's been really hard on a lot of people, and especially emotionally, and some of the older people. And I have to say, from personal experience, I feel so bad for many of my friends whose parents were in nursing homes, especially those of my friends whose parents had Alzheimer's, dementia, or some type of dementia, because my mother had Alzheimer's dementia. And I couldn't even imagine not being able to touch her for a year or to go really get in there and hug her. It would have been very to me. And a lot of people are going through this. So think hard about the decisions you.
Yeah, and I need to ask and to add to all those good points, because as Dr. Walker's talking, I'm also going through my mind all the other things people have said to me that they've heard on social media. And so these are the things that I want to say I have heard, or if I haven't heard them, I want to state some things that we know as facts of March 15th, 2021, the Ides of March. The COVID vaccine does not cause infertility. It does not. You heard the not in there. The COVID vaccine was based on science done by very safe, excellent investigators and scientists in safe laboratories. I tell people, even though that warp speed was a terrible name, the vaccine came through science, not science fiction. It came through science. I also want people to know that for the millions of people who have gotten the vaccine across the world, but not equally and equitably across the world, the vaccines have shown themselves to be safe in the vast, vast, vast majority of circumstances. Very, very few other than the simple arm achiness kinds of things that you get, they have been shown themselves to be safe. And I know we're going to get to this question. Right now, in my mind, there is no such thing as a second-class vaccine. So they, whoever they might be, are not trying to come up with one batch for some folks and one batch for another folks based on one being better than the other. Those are just some of the things that I just wanted to mention because I have heard people question it. And we might get to this. There's so much I'm sorry, I'm talking a long time, but there's so much in the news right now about these variant strains, these ways in which the virus has changed a little. So some people have said to me, what difference does it make? The virus has changed now. Should I still get the shot? Well, all of the investigations ongoing are showing that the vaccines still are working. So I just had to get that off my chest.
Thank you. I think that those are wonderful points to share. And it actually kind of segues us right into one of the questions from our audience members. They asked, so there are three now vaccines available. And they asked, does it matter which one I choose? Because they know that Johnson & Johnson is roughly 86% effective, and then Moderna and Pfizer are in the 90% effectiveness range. So what does that mean? How should we take that into consideration? I really like what you said, Dr. Mullen, about there is not like a second class vaccine. Like these are all very effective vaccines. But if either of you could speak to that question, that would be wonderful.
Well, I think you should take the vaccine that's available to you, okay? Because first and foremost, if you've decided to get it, you get that vaccine. Yes, some in studies may have been 4% better than the other. That doesn't mean it's not effective. They're very effective, and some of the ones that have the lower overall benefit actually prevent hospitalizations altogether. And having the vaccine in your system allows your body to interact with any variants that may come. You can't, at this point, it's not being picky, and we've never really asked really with other vaccines, oh, who made that vaccine? I think I want that vaccine. Let's just, if you're going to do it, get what's available to you as soon as you can, because it will be helpful. And again, the flu vaccine hurts worse. Let me tell you, I had basically no symptoms the first shot. Second shot, a little bit of soreness. The flu vaccine hurts way more than this vaccine.
I got Pfizer, my husband got Pfizer, my daughter got Moderna, my son just got, she works in a clinical setting, he works in an educational setting, and my husband is old enough or something. And so anyway, we all qualified. You know, the other things that are different might be Pfizer 3 weeks apart, Moderna 4 weeks apart. And right now, through the Food and Drug Administration, Pfizer has been authorized for people 16 and younger, the other two 18 and younger. But now we're going to eventually find out that whether or not kids will be able to get them too. So even that's going to be less relevant. And Carmen, I know there are more questions.
No worries. Thank you so much. I see a hand. Bernard, were we able to get to your question? I know one of them was in the chat, but are you still there? Do you still have a question? You can go ahead and unmute. Or, okay, I think we got the question.
Yes, it was answered. Thank you very much.
Okay, wonderful. I just wanted to make sure. Okay, so another question that we have regarding the vaccine has to do with adverse effects, because some people do have allergies to certain things that are in the vaccine, and that's sort of been the narrative going around. You know, if you're allergic to something in the vaccine, then that is sort of one of the higher risk reasons that you might have an adverse reaction. So someone asked, does the vaccine contain shellfish or a shellfish derivative? And if I'm allergic to shellfish, would that stop me from taking the vaccine? Are there concerns for having an adverse event in that scenario?
Okay, there's shellfish, no. The technologies used for both of them don't involve shellfish. Some people might read that there were some Catholic bishops that had encouraged their congregations, not Dr. Walker, I can see your eyes rolling, but you might see mine roll.
I agree with you. They did encourage them to not take it.
Right, my eyes are going up in my head, saying they were concerned that there might have been the use of embryonic stem cells. The Catholic Church large has encouraged people to take vaccines. vaccinated. So no to shellfish. There are some people early on who we learned had a severe allergy to one of the products that, that is part of the vaccine. And so those individuals who are known to have a severe condition called anaphylaxis are encouraged to talk with their docs, have an EpiPen. If they have any reaction the first time around, not to get the second shot, but those have been really, really rare.
Yes, and I think it's also important to note, because this came up in a past town hall, that if you do have concerns, there is a list of the ingredients in each vaccine on the company's website. So again, echoing what Dr. Mullen said, you know, talk with your doctor, have those conversations, be prepared, and also do your research, because knowledge is power, and it is really important to know and to feel comfortable. So yes, thank you. Dr. Walker, did you have anything you wanted to add to that, or?
No, I agree with that. Exactly what she said. I think if you really think about it, I guess when they first started giving vaccines out, you've heard a few reactions, but the reality is we really haven't heard about many reactions, severe reactions. But again, if you tend to have anaphylaxis with other vaccines, then you definitely should talk to your doctor before you make the decision about taking this vaccine.
And if you're pregnant, you know, that doesn't mean you can't get it either. Thousands of pregnant women have received the vaccines, and that's another decision that's yours and that you can discuss with your clinician.
So we have another question in the chat, and I think this is a really important question. We talked earlier about how, you know, COVID has really been hitting everyone emotionally pretty hard. Someone put in the chat, they said, my 12-year-old daughter's question to me today after school was, when is it going to be over? When is it when everyone gets the vaccine? And they asked, what do I say to her? Because I don't want to give her false hope. And someone else asked, once I get the vaccine, or like the first dose of the vaccine, can I visit my grandparents? You know, can I visit my relatives? And, you know, I definitely, I think those are questions that a lot of us are having right now, because we have been so isolated in the past year, and we want to return to some sense of normal. But if you guys would like to speak to that, I think it is important to consider all of the safety, you know, precautions. So Dr. Mullen, Dr. Walker.
So I'll work backwards. Unless you receive the Johnson & Johnson vaccine, which is one shot, you can't consider yourself fully vaccinated unless you've received two, because to really be fully vaccinated with Pfizer or Moderna, you need to have both shots. And so you might see some stuff about, oh, there's a little bit of effectiveness with one shot of Moderna or Pfizer. You're not fully vaccinated without two of those. And now the whole issue of being able to see loved ones fully vaccinated, that's one issue. So fully vaccinated to protect a loved one must consider then the vaccine is one part of it. But even if a vaccine were 99% effective, there's still that 1%, right? So in this time, when we're still watching community spread of COVID-19, when you are allowed to visit, still use the other precautions, such as masks, et cetera. And I can't get into all the details, but maybe we can send them about how now CDC has said, if you're vaccinated and other people are vaccinated in a small bubble, then you can be able to get together. But the details of that are more complicated than I can get into here. And then when is it going to be over again? Well, I started out saying I was hopeful. So what I'm trying to do, and this might be a way to have a conversation with the 12-year-old, is to show the glimmers of hope along the way. The glimmers of hope of being able to see more children be back in school some. The glimmers of hope of being able to have smaller gatherings. The glimmers of hope of having the president say what he wants us all to look forward to by the 4th of July. And to start looking at it that way at the same time that if we act like other countries that have been successful even with COVID, we say, even when it's over, there might be some things that have become habits that we still have to hold on to. Don't throw your masks away, for example. One last thing I would say for parents, I had a conversation with some mayors in Texas last week about getting kids ready for school. In the same way that Dr. Walker talked about children, adults, women's falling behind on the breast cancer screening, and even cancer patients not necessarily staying in their treatments. There are going to be a lot of children who, when it's time to go to school, are not going to be up to date on their shots. So I was trying to get them to start thinking about how to plan ahead, because childhood immunizations have fallen off over the past year. And trying to get back to school and then hearing a school nurse say you can't come because your shots aren't up to date is just going to throw more into disarray. I'll stop.
That was something I hadn't even thought about, and I think that is such a great point. Thank you so much for bringing that up. Because yeah, immunization at the school level, that is really where so much of it is enforced, and people haven't been going to the doctor as much because of COVID. So yeah, that is so important to think about. So we have another great question in the chat. I'm sorry, I'm trying to keep all of these questions coming that are coming in straight here. So someone said Dr. Mullen made reference to folks with comorbidities to get the vaccine, but unfortunately, because of Governor Lamont's shift to age-based access, that's not necessarily a possibility for those who want to take it. So now the folks who are overexposed and have comorbidities have another barrier. What can be done to mitigate this new barrier? And how can public health shift the narrative that keeps being pushed that people of color aren't vaccinated because of hesitancy, when really access is a greater issue when it comes to equity? I think that's a great question. I love that question. So Dr. Mullen, would you like to go first? And then Dr. Walker, will pass it off to you.
I declare every day that I am not an organizer or an activist. And I read the Hartford Courant every day because I still live there sometimes too, even though I'm a Texas resident. In my professional opinion, Connecticut needs more activism and more advocacy around equitable vaccine allocation. I'm going to say that as the former Connecticut Public Health Commissioner who has bitten her tongue and put her pen down too many times when she wanted to write a letter to the editor or call somebody and say, would you like my opinion? Because I don't want to undermine the current Public Health Commissioner, who I think is doing a good job. But I understand that Governor Lamont looks in a certain way to have sort of let equity potentially falter some in the effort to go for efficiency. People need to hear about it and keep advocating for it. And so that would be one thing. And then the other point that I would make again is that risk conditions matter, occupations matter. And so try not to think in a too restricted way around what the categories are. I do hope that because more vaccine is becoming abundant, it's going to be less of a problem, but I also know Connecticut, like a lot of other places, still has to do a better job of getting vaccine to people instead of setting up more places for people to go receive it. How's that?
I will just add two words because I'm not quite familiar with what has been going on in Connecticut, being that I'm in Michigan. But I agree with the advocacy. We have to be our greatest advocate. And unfortunately, people of color work in many of the jobs that put us at high risk. And so we have to put it upon our local governments. You need to bring it to us. If I can't come to where you are, one of the things we're doing in the Detroit area is we have pop-up clinics, just like we have mobile mammograms. We're having these mobile units going to where people are to give them. Now with the age matter, again, I agree with the advocacy. You're going to have to fight with them. It takes work, But, you know, when there are a lot of people talking about the same thing, it usually gets done.
I'm going to quote myself. A reporter asked me about the hesitancy issue, and you are welcome to also say, how can you call people hesitant if you haven't given them access? We can no longer abide that excuse. And even when people call doctors like me and Dr. Clark and ask us about vaccine hesitancy among Black people, we can say, I don't know if you've gotten those calls, but I've gotten asked that a lot. And I will not reinforce the notion that we are less vaccinated because of the desire to make up our mind like other people want to make up their minds at the same time without being given the information, which doesn't mean there are reasons that a number of people are more suspicious of the medical system. But in the meantime, wanting more information is not the same as refusing.
I completely agree. I think that was so wonderfully put. Thank you, Dr. Mullen and Dr. Walker. Another question that we have that's in a very similar vein that was asked in the chat, someone said, given that we live in a country where government and corporate policy take advantage of scenarios where they can regulate and control individual access to an array of benefits and services, coupled with a supreme indifference to the lives of persons of color, what do we do to prevent the abuse and oppression that is so regularly dealt out to marginalized communities? And I think this loops back a lot to what you were saying about activism. And I love that you incorporated that in the last answer. And so to kind of tack on my own piece to this question, would you be able to talk a little bit about maybe ways that people can advocate? Because I think a lot of the times, you know, based off of these two questions, we sort of feel like, well, what can I do? You know, it can be very difficult to kind of figure that out. And but there's power in numbers, and there's power in working together, and activism is so important. So if you could also speak to, you know, ways that our community members might be able to, you know, try to combat some of these things that they're seeing, that they're experiencing, that they're acknowledging.
Want to go first, Dr. Walker? Okay, I, who am not an activist or organizer, have also recently been answering questions about data, where I'm asked to compare what's happening to Latinx community compared to Black community. Why are the mortality or hospitalization rates or death rates a little bit worse here or there? And my response most recently has been, they're bad across the board. And the reason I make that point is because collectivism in these issues, to me, is also not being broken down by our racial and ethnic groups, because that cohesion for all people who are fighting oppression and trying to really stand for justice is going to work a lot better when we don't end up fighting against one another. I hope that makes sense. And then, you know, we talk a lot about empowering communities. Look, communities do have power. So I think the other thing is you don't have to ask to be invited in, but then people who work in medical schools and other organizations like me also can't wait to just call somebody when we think they can add a little bit of something, instead of being partners in planning the approach. Because the strategies have to be strategies that everybody believes will work. Can you tell I'm in over my head?
Oh, and I would say, just like my hospital system, we want to know what the community wants. You should follow what Dr. Mullen says, and you go to them and you say, look, you're not doing it right. We want to give you some input as to how our communities can work together to help give access to these vaccines. And as Dr. Mullen said, all the communities that are at high risk, that are affected the most, there's power in numbers. You work together, it will improve the situation.
Thank you so much, both of you, for those responses. I think that that is absolutely just it's very empowering, and it's wonderful to hear from both of you, ways to think about and navigate this very difficult situation. So I know it's past 8 o'clock and that's our end time, so we want to be respectful of your time. We have one more question. I'm going to take one more question if that's all right. Um, there, let's see. Someone had asked if you have had strokes or seizures. Would the vaccine be effective or harmful? And just, I have a little bit of the reason I am taking this question, I have a bit of a soft spot. I have family members who have experienced these things. I know that those are concerns for them as well. So can either of you speak to any of that, I guess?
I haven't seen any data or reports to say that those would be issues of concern. And if we think about the people who have been most impacted by COVID and who were the first ones that, other than healthcare, direct healthcare workers, who we said needed to get the vaccine, it was older people, the older people, and many of them in nursing homes, right? And that's going to be so we've got a large population of very much older adults in whom diseases like strokes are also much more common. And we haven't been seeing along the way bad results, negative results. So the person who has had strokes may also have underlying conditions like heart disease or hypertension that are also risk factors. And so, at an individual level, there's always the discussion with one's doctor. At the population level, I would say, I'm not aware of anything that would make, for the average person who's had strokes, that they should not get the vaccine.
I agree. I have not heard anything. And again, talk to your own physician.
Wonderful. Thank you so much to both of you. Everyone who is here this evening, thank you all for coming. As a round of applause for our wonderful guest speakers, Dr. Mullen and Dr. Walker. We have been so honored to have you here with us. You were wonderful. I've learned a lot in this conversation, and I hope that our community members have also felt very heard and learned a lot. We do have another poll, and it will be put into, not in the chat, but Jason will launch the poll. Everyone who's here, if you could please fill that out before leaving the session. Again, this is just for internal use so that we can respond to community needs better with our next town hall. So thank you so much again, Dr. Mullen and Dr. Walker. It's been an absolute pleasure having you both here this evening.
You're welcome.
Thank you.
It's been my pleasure also.
Thank you, and do send an invitation for the recording to Governor Lamont's office.
Oh yes, that is like a very
A
good
great idea.
That's a very good idea. All right, so thank you so much.
Thank you.
We'll take a few moments to fill out the poll, and I would like to thank everyone for coming tonight on behalf of Crystal Emery and the URU team. We hope that we have been helpful, and we hope that you'll join us again for our next town hall. We have another town hall in Spanish on Tuesday next week, and another town hall in English on the 29th, I think. So it's the Monday afterwards. So as always, the links and phone numbers, the Zoom information, the password, it will all stay the same. And please spread the word. Feel free to invite family and friends. This is a free resource. We want to reach as many people as possible. We have wonderful doctors like Dr. Mullen and Dr. Walker with us every week. Again, thank you to the both of you for coming and being here. And we are humbled to be able to serve our community. And again, on behalf of Crystal and our whole team, namaskar. Have a wonderful evening. All right, so we will close the poll in just a few moments. If everyone could wrap up their answers. And again, thank you so much, everyone, for joining us. And we hope to see you again, either at a Spanish town hall or at an English town hall in the coming weeks.